All right, so what we're going to do today is for the first hour, I think there'll probably be a couple that come later. We're going to do the immune topic, and then we'll move into some revision. And then there is a little Jeopardy game we have to play. Probably not, going to be great experience for you with so few people here, but there are some questions in there that I need to go through with you so that you're really well prepared for the test. Has everybody got their endocrine quiz result? No? You did? Did you get your feedback? I was freaking out about the feedback. I think you should be able to see the feedback. I don't actually know why you see it. Does that migrate? Your migraine. Okay, so if you go into the actual assessment. Can you move around that one the top? Before? Okay. Let's go over down to the bottom. Yeah, excellent. So you have to go into assess your actual assessment tab. You found it?
Yeah.
Yeah. Okay. All right, we're going to start with lymphatics today. And we're going to do all the activities together. There's no songs or dances or plays or anything like that. This is really just a tutorial to emphasize the important elements of the topic, and it's really focused on the test. So there's lots of activities for you to do. So I might just get rid of me. We don't need that. Yeah. And we're going to start with activity 1, and you're just going to shout out the answers if you know them or seek clarification if you don't. So which structures of the lymphatic system filter or clean the lymph? Lymph nodes, fantastic. If some of these structures were removed, as shown here, what functions of the lymphatic system would be affected, and what might it result in? So what we're looking at here is a breast tumor, and the nodes closest to the tumor are called the sentinel nodes. So they're acting like guards, like sentinel guards. But what happens is the cancer cells can migrate to the sentinel node. Once it's in the sentinel node, then it's going to have access to the circulation, so the blood circulation. And that's how, cancer spread around the body and then seed themselves in other parts of the body. So very often that sentinel node and perhaps other nodes need to be removed if they find cancer cells in there. Okay, so if you were to do that and knowing the functions of the lymphatic system, what might happen here?
You have force filtration function immune responses.
In that local area. Yep. So we do know that immunity is a function of the lymphatic system. What else is a function?
Production of like antibodies and stuff like
Yep, so that's all happening in the lymph nodes. But what else does the lymphatic system do? Fluid balance, absolutely. So if you remove some of those nodes there, you're probably going to get local swelling in the area. So lymphedema. Now, if anybody is in physio here, in third year, you will do some modules in a subject on how you treat lymphedema. Okay, so but that's in third year. And you know, I guess the lipid absorption is not really going to be an issue in this local area that occurs in the small intestine. And you know, we're only removing a couple of nodes here. You've got hundreds more. And the immune function might not be such a big deal either. Okay, so now moving on, if you looked inside one of these structures, what are the main elements that you would find?
You're gonna have your lymphocytes. So
Yep.
T cells.
Yeah.
Macrophage.
Yeah, nice. I just have to do one little thing that I forgot to do before class. Okay, so yeah, you'd have immune cells, absolutely. Anything else you'd have? Okay, I'll bring up a little lymph node for you. There's a lymph node. So you'd have all those really fine connective tissue fibers called reticular fibers. And they have to form the structure inside the lymph node that the immune cells can attach to. You've also got these vessels that supply the lymph node, and you've got other vessels that drain it. These ones have a bigger diameter to the ones that drain it, so they're going to deliver lymph in, and it's going to kind of remain in here for a while because these ones have a smaller diameter and there's fewer of these as well. And that's going to, you know, delay the emptying of the lymph from the node, and that allows all that mixing and for any pathogens to come in contact with, you know, lymphocytes that might recognize them and then be activated. Okay, and I just list two other functions of the lymphatic system. So we've
Tonsils, spleens, and
yeah, absolutely. So we did this bit of it, immunity and intestinal lipid absorption, but you're absolutely right. Two other components of the lymphatic system could be your thymus or your spleen, your lymphatic nodules being the tonsils, lymphatic vessels, lymphatic ducts, lymphatic capillaries, all of those sort of things. Okay, so that's just a photo there of somebody with very clear lymphedema. And I just love these. They're just there because they're nice and fancy. Those sort of stockings for the lymphedema. Okay. And they're the functions then of some of those other things that we just mentioned. The spleen, it does act as sort of a blood reservoir, and it also sort of destroys old red blood cells, and it's the one that filters the blood, whereas the lymph node filters the lymph. The thymus is the site of maturation of T cells, and those tonsils are really important in being that first line of defense for any pathogens then that sort of enter through the oral or nasal cavity. I don't know about you, but does anybody here get severe tonsillitis? No? No? Well, For some people they do, and they get really swollen, which is, you know, what they're supposed to do when there's an immune reaction, but you know, that can be very painful and also, you know, can disrupt sleeping and speaking. Okay, so we've just talked about this, but can you indicate to me what the names of those vessels are that supply and drain the lymph node? And also what might be happening here at this red arrow?
So that's your pattern,
Yeah.
And it's that where you're gonna have phagocytosis happening with the cell.
Not quite phagocytosis, but you're very close. This is the germinal center, and this is where the activation T cells and B cells will divide really quickly and proliferate. Okay, what we're going to do now is, we didn't laminate these, so it's okay. Using these words and starting at lymphatic capillaries, can you label that diagram in your worksheet? Okay, so this diagram here has, you know, probably more detail than what we did it in the in this topic. You don't need to remember that they're spindle shaped endothelial cells. Endothelial cells is fine. Lymphatic vessels, they are obviously collecting lymph, but you don't need to be able to name them as collected lymphatic vessels. We have our afferent, we have the inner sinuses, so the medullary sinuses, the efferent, and then the thoracic duct. And there, that's it. You don't really need to remember that they're oak leaf shaped, but I guess, you know, the way they sort of overlap each other is kind of important in terms of how they form those one-way valves. And then, of course, we do have the proper lymphatic valves in those larger vessels. They're in the capillaries. Okay. All right, here we go. We might do this one together, I think, because it's pretty straightforward. I'll just get rid of this floating thing. Maybe not. Okay. So all we have to do is pick one of these to match each statement. Where do T lymphocytes mature? Define this. What might be bean shaped? The lymph nodes can be oval and bean shaped, yeah. The largest lymphatic organ? Spleen. Site of multiplication of activated lymphocytes. Lymph node, yeah. Stores blood. Spleen. Made up of two lobes. The thymus, yeah. Red blood cells, whenever you see blood cells, you know, you're thinking about the spleen. So red blood cells destroyed here. what will be distributed throughout the lymphatic system?
Lymph nodes.
The lymph nodes, yeah, you've only got one thymus and you've only got one spleen. Maximum weight is usually 30 to 40 grams. Yeah, the thymus lies below the diaphragm. Spleen, absolutely. At its maximum size at puberty. Yeah, the thymus. So, and you know, it sort of undergoes atrophy as we get older and older. So that's why, you know, elderly people are more susceptible to infection because they don't have all the you know, the T cells. Filters lymph nodes, oval in shape, lies immediately behind the sternum. And can be a pinhead size to an almond. Lymph node secretes thymosin. Thymus synthesizes fetal red blood cells. And then phagocytoses cellular debris. Where does that happen?
Spleen, and also
Yeah, so both the spleen and the lymph nodes. So phagocytosing sort of all red blood cells. And then obviously, you know, antigen kind of presentation occurs in the lymph node. Oh. Okay, got a little scenario for you, and it's pretty much just covering kind of everything we've talked about today even. So we've got Jack, who's not feeling very well. He's tired and he notices some swelling in the neck and underarms. Jack is worried, visits the doctor, and the doctor performs an examination and suspects that there's an infection. To confirm the diagnosis, the doctor orders a blood test and a biopsy of one of the swollen lymph nodes. So you can see Jack here. Have you played around with DALL-E in Copilot? The image generator? It does a pretty good cat. So, and I haven't acknowledged it then, which is very naughty, but anyway. Explain the role of the lymphatic system in the body's immune response and how it might be involved in Jack's symptoms. So we know that he's tired. So that's usually, that can be accompanied by swollen lymph nodes. It looks like he's got an infection. Yeah. And that sort of fatigue and lethargy is a sign of an infection. And of course, the swollen lymph nodes, because there's activity in the lymph nodes to try to get rid of whatever is causing the infection. So they're going to be like really swollen. I'm sure you've all at some stage had swollen lymph nodes and they're really sore. Yeah. So yes, so the lymphatic system and the lymph nodes, the immune response is occurring there. You've got your macrophages sort of presenting antigen to lymphocytes, those helper T cells, and those helper T cells with the particular receptor that recognizes the pathogen then gets activated and starts to divide, yeah? But what else do those helper T cells do? They secrete cytokines, right? And those cytokines then cause B cells that recognize that pathogen to divide as well, and also those cytotoxic T cells. And in doing all of that, you're getting memory cells being produced as well. Okay, so the one thing I was trying to stress in class yesterday is that helper T cell, sometimes called the CD4 T cell, is pivotal to the whole adaptive immune response. If you don't have helper T cells, you're not going to have an adaptive immune response. Is everyone following me? So what would happen then if it was actually the helper T cell or the CD4 positive T cell that was the one that was getting infected itself? You wouldn't have an adaptive immune response over time, and that's what happens with HIV infection. It infects the helper T cells. So previously, before we had antiretroviral therapy, over a period of about 10 years, that CD4 count would just drop and drop and drop and drop and drop until it was under a particular level that then the person would be diagnosed with AIDS. And somebody doesn't happen as much now, obviously, because of the therapy. Somebody then with AIDS would unfortunately die from opportunistic infections that Brendan would have taught you about. They don't, your immune system can usually deal with those antigens, but for people with suppressed immune systems, it becomes an issue. So it's not that they died from a lack of CD4 cells. It was because the lack of CD4 cells meant that they couldn't fight fungal infections in particular. And so that they became, lethal. Thank goodness it's not like the progression of the disease. It's not like that anymore. Okay, describe the significance of a lymph node biopsy in diagnosing infections or other conditions. Everybody know what a biopsy is? You just take a little bit of tissue and look at it under the microscope. So it would be good at diagnosing a couple of different things.
Infections, autoimmune disorders, cancer.
Cancer, absolutely. Yeah, you can look at the cells in there, and if they're all erratic and pretty messy looking, can indicate cancer. Obviously, a lymph node biopsy will be done with, blood tests as well to look at which white blood cells are increased in terms of bacterial infections and viral infections. So remember, the neutrophils were really high with the bacterial infection. What are some possible causes of swollen lymph nodes? We know, we've just mentioned that. It's kind of repeating it all again. So infections, cancer. When Jack starts to feel better, he decides to do some exercise. What effect will this have on lymph return? And what other processes help with this? So what? He's starting to feel better. He's off the couch. He starts moving around. What will that do to lymph return? Will it increase it or decrease it? Increase it. So the exercise is good for doing that, but what other processes help with moving lymph? Yeah. Yep. What about movement? What are you activating with the movement? The skeletal pump. Yeah. And that contraction and relaxation is going to move that lymph along. You're also going to have the valves opening and closing with the contraction of the skeletal muscle, and that helps with that one-way flow of lymph. You've also got the thoracic pump. Okay, so when you do get to the respiratory system, in one of the recordings, I speak about the muscles of breathing. At rest, it's all about the diaphragm. But if Jack is exercising here, he'll be recruiting accessory muscles of breathing like the scalenes, the sternocleidomastoid, the pectoralis minor, and also the abdominal muscles. Okay, and the contraction. Oh, I'm not even sure what I've just opened. This could be very dangerous. No, we'll leave it. And sort of, the contraction of those abdominal muscles will then increase that intra-abdominal pressure, and that, is obviously going to have more forceful expiration to allow you to exercise. And obviously you'll have all other muscles of contraction occurring. So the sternocleidomastoid, all those ones contracting to allow forced inspiration. But what we're concerned about here is this all helps with lymph movement. So, oh, we missed one. Smooth muscle in the lymphatic vessels as well can relax and contract to push the lymph along. Okay, so that's all we're going to do on the lymphatic system. We're going to move straight on to the innate immune system. So I'll give you 30 seconds because this is very easy to see where you put all those cells and those couple of words there. Do they belong to the innate immune system or response or the adaptive response? All right, where are we putting natural killer cells? Innate, yep. Very important type of lymphocyte, but just have the same reaction to virally infected cells and cancerous cells every time. Where would you put your monocyte? Innate. Where would you put your plasma cell? Adaptive. And the basophil? Innate. B lymphocytes? Yeah. Neutrophils and eosinophils? Yeah. Memory cells? Macrophages? Yeah, and they're with the, the link, but what they're all kind of linked, but that's a big link between the innate and the adaptive because they carry out that antigen presentation. Helper T cell. Yeah, cytotoxic T cell. Not non-specific. Innate and specific. And I should have had memory as well for the adaptive one. Good. All right, now, identify the surface chemical responsible for the following functions. What surface chemical traps microorganisms in the respiratory tract and is moved by the action of cilia? Pardon? So what traps things?
The villi.
Not the villi. So the cilia are those little extensions that brush this stuff in an upwards direction in the respiratory tract. And it's trapping this stuff. You might have a bit, pardon? Mucus, yeah, with your cough, you might have some mucus. I've got a cough and I've got mucus. Okay. Found in the stomach, has a very low pH and kills and inhibits microbial growth. What do you find in the stomach? Yeah, hydrochloric acid, very low pH of 1 to 2. Secreted by sebaceous glands and prevents microbial growth. What comes out of your sebaceous glands when you in your skin? No, it's the other one. It does begin with an S. Sebum, yeah. Very good. Found in tears, saliva, sweat, and nasal secretions, and it lyses bacteria and other cells. And it gets its name from lysis. Lysozyme. Don't get your lysosomes and your lysozymes mixed up. Explosive removal of microbes and debris from the respiratory tract. Sarah. Is your name Sarah? Oh, I've always thought your name is Sarah. What is it? Olivia. Okay, what's your surname?
David.
And yeah, okay, because there's a couple of Olivias. Yeah, yeah. So Olivia, explosive removal of microbes and debris from the respiratory tract. What have you got? What have you been doing for 2 weeks? Coughing and sneezing. Yeah. All right. Okay, we're going to move on now and talk a little bit about inflammation, if you don't mind. So Sarah is 20. She's accidentally cut her finger while preparing dinner. Within a few hours, she notices that it is red. It's a bit swollen and it's a little bit hot around the cut. Sarah's curious about what is happening in her body and why these symptoms are occurring. So I've got a series of questions for you here. I'll give you a little bit of time to think about it and then we'll go through them. What is inflammation and why is it important? How does the body initiate the inflammatory response? And what are the primary goals of inflammation? And then we'll just do them first and then we'll move on to the others. So you don't have to write down frantically. And in the test, everybody, I think I'm pretty sure it was pretty late last night when I was writing on the discussion board about the test. If you do start, there will be some written response questions. There's not that many, but if you do start with them, don't spend a half an hour. We're not looking for an essay. We're just looking for little points about the main elements of, let's say it is inflammation, or let's say it's the adaptive immune response or blood pressure, reflexes or something. Just get it in and move on, okay? Otherwise, you'll find yourselves struggling to finish. So probably 3 to 5 sentences is perfect for some of the questions. So what is inflammation and why is it important? So it's an innate immune response, exactly, to tissue damage, which might be caused by an infection. But remember, infections are not the only cause of inflammation. I'm sure you've all sprained something, twisted an ankle or something like that. Inflammation, obviously, can be ongoing. If somebody has autoimmune conditions where that inflammatory response sort of flares up every now and then. But let's just say that's not the case. Let's say you've got a splinter, there's a bacteria on the splinter, like Sarah here, and she's got an infection in the finger, let's say. So why would inflammation be important? Because it's a stage of tissue repair, yeah? It goes with coagulation, inflammation, cell recruitment into the area to clean it all up. And then eventually you get cellular migration, and then you get the tissue being remodeled or regenerated if the damage is not too bad, or remodeling with scar tissue if it is very vast. How does your body initiate the inflammatory response?
Recognize it's possible. Stimulus and start releasing chemicals.
Yeah, and which is the one we always talk about? histamine. Okay. Now, if you do get a long answer question that asks you to talk about a chemical mediator, I'd be advising you do histamine, but don't neglect the other chemical mediators. You know, they but I don't think we went into them in as sufficient detail as this guy here. Okay. So the primary goals then of inflammation are to deliver blood to the local area, to allow all of those white cells to get to the area, also to create a situation where those white blood cells can get out of the blood and migrate to the damaged tissue, phagocytose, and set up an adaptive immune response as well. Okay, this table here, Cyrus and Hafiz, can you give me one of the classical signs of inflammation? Swelling, very good. Okay, that's one. I've forgotten your name. Lockie and Olivia, can you give me one? Heat. Dana? Redness. So we've got swelling, heat, redness. What are we missing? Swelling, heat, redness. Ouch. Pain. Yeah, and so they're the four cardinal signs, and then we often put in a fifth one, which is what? Loss of function. And is loss of function sort of beneficial? Usually it's temporary, right? Which is good. But in some situations where the inflammation is very severe, it can result in permanent damage. But for the most part, the loss of function is temporary, and that's a good thing because you've got tissue damage. You don't want, if the damage is in your foot, you don't want to be walking along creating more damage. So the pain and the swelling can lead to the loss of function. Yeah. Okay, can you explain the vascular phase of inflammation and link this to the cardinal signs of inflammation? And I'm going to give you the exercise on the next slide to help you. Oh, no, I'm not. Okay, so this has come from your notes. I've just shaded out some of the words from your notes. So have a look at it, decide what chemical mediator you're going to pop into that phase box. Then think about what's happening here and what signs that leads to. And then what's happening here, what does that lead to? Kind of what's happening here, which will kind of slow down blood flow. Happening here. And what are the signs of these two? They're just... And then once you've identified those in your head, can you write a couple of sentences on them to answer that question? All right. So what are we putting up here? Put the leukotrienes up there if you wanted to, or other ones. What do you say is happening here? Dilation, yeah. So arterial dilation or just vasodilation. So remember, histamine is like a signaling molecule. It will bind to a receptor to cause a smooth muscle to relax. Right? It initiates a whole series of events that causes the ring of smooth muscle to relax. So the passageway for blood gets bigger. So we get vasodilation. What does vasodilation lead to? More blood flow. So what two signs will that cause? Redness. Redness, absolutely. And what else? Heat. Yeah. Okay, so that's good. At the same time, so you've got blood rushing in, and you're going to have the venules dilating too. So if you've got venules dilating, that's going to slow the blood flow out of here. Does that make sense? Yeah, because other things are going to happening in here at the same time. What's happening to the capillaries? Yeah, they become leaky. Yeah. So literally, histamine will cause those endothelial cells to pull apart and create a gap to let stuff out that usually doesn't get out of the blood. So cells and proteins and stuff. And what would you put here? Exudate. If you can't think of the word exudate, you could just say it's protein-rich fluid. It's fine. Okay, so if we've got these leaky capillaries, what's that going to do to the signs?
It's gonna swell.
Yeah, edema or swelling. I don't mind which word you use. Loss of function, yeah. And what else? Pain, yeah. So that swelling can sensitize those nociceptors, which are those sensory receptors that are activated by tissue damage or even potential tissue damage. Once they start firing off action potentials up to the brain, that's where you get that conscious perception of pain. So I'm sure you've already heard the pain's in your head. And it's because of that pain pathway up to the higher areas of the brain. Okay, pain can also be due to histamine sensitizing those pain receptors directly, and other chemical mediators as well can do that. Okay, so we've got the vascular phase under control. Why might loss of function occur in the area? We've talked about the swelling and the pain. Can you list some cells that migrate into the area and explain what they do? So what cells, so this is an innate immune response. So if you think back to the table where we put the things into the innate immune response, what cells do you think would migrate from the blood into the affected area? Absolutely, neutrophils, and they're the first ones to go. They race off and phagocytose whatever they find and die. I always feel sorry for them. They're just like a very short lifespan, but I mean, anyway. Okay. What else? What other cells do we have? Monocytes, yeah, they get out too and differentiate into macrophages and also dendritic cells. And those two cells, as well as B cells, are antigen presenting cells. Yeah, for the adaptive immune response. What other cells might go into the area? Eosinophils as well, they get out. What cells release histamine? Tissue mast cells, absolutely. So you would find loads of those lining your mucous membranes. And basophils in the bloodstream as well. Okay. Can you identify two functions for prostaglandins? Does everybody know what a prostaglandin is? Anyone? You do. Cyrus? They are inflammatory mediators, and they're released or they're made from, let's say you've got tissue damage. Oh, that's not very good marker. When you've got tissue damage, you're going to have damage to plasma membranes, right? And that releases an acid. You probably need to remember this, but I just think it's interesting. an acid called arachidonic acid, and if you do pharmacology with me next year, we'll talk a lot about arachidonic acid, okay? Arachidonic acid is then converted to prostaglandins, right? And also thromboxanes, which will promote coagulation. All right, so, and that's done by an enzyme that you don't need to know the name of yet. So, if you've taken a Nurofen, like if you sprained your ankle or something this morning, you've got a headache, you take a Nurofen or Panadol or an aspirin, what it does is it blocks that enzyme. Okay, and by blocking that enzyme, you reduce the production of these two. And that's, and prostaglandins promote inflammation. So if you're blocking that, that's why they have that anti-inflammatory effect. Yeah. And also aspirin, a little baby aspirin, will block that as well. And that's why people with clotting issues, maybe your parents or your grandparents even, are taking a baby aspirin every second day to block this. And so it has that antiplatelet effect. Okay, so we're going on to talk about the functions of these other sorts of inflammatory mediators. What you'll see is they kind of do all the same things as histamine. So things like increasing vascular permeability, sensitizing nociceptors as well, attracting phagocytes by chemotaxis. Does everyone know what chemotaxis means? And actually, try and put these three words in the same sentence. Diapetesis, phagocytosis, and chemotaxis. So you could write, does everyone know what diapetesis is? So this is how the white blood cells get out of the blood. So remember, the endothelial cells contract, and they kind of shoot out their plasma membrane and then bring up the rest behind them. And they kind of get out in a caterpillar-like motion, which is called diapetesis. Okay, so histamine will promote this diapetesis. So the white blood cells are out, and then they want to get to the infected area, let's say. The infected area might be due to bacteria that release toxins, and those toxins are chemicals, right? So the white blood cells move from the blood via diapetesis, and they're dragged to the site of infection via these toxins, which kind of are very strong here, and then they kind of get sort of more dilute the further away from the infection. But the white blood cells move via chemotaxis, so along this chemical gradient, to the infected area where they can carry out phagocytosis. Does that make sense? Taxis meaning movement, chemochemicals. Okay, this is just a little practice for some of the test type questions that you're used to. There's a typo here. Select 4 correct statements about histamine and just tick in the right column which ones you're selecting. I'll give you a minute or two to have a look at that. There you go. Looks sore. A lot of inflammation going on there. There you go. Maybe if you need to come into class. Much appreciated. What would you like? Chicken monkeys or what? Like yesterday's. So many things that I for. Which one would you like? Or 110?
Either or.
That one there. Oh, no, no, no. Not very good. Right there.
Oh, perfect, there we go, looking good.
Okay. We know what we're ticking. What about this first one? Is histamine released from mast cells and lymphocytes? No, it is released from mast cells, but not lymphocytes. Mast cells and basicles. Does it cause vasodilation and redness? Yes. Does it decrease vascular permeability to cause edema? No. Does it stimulate mucus production and tear production? Yes, it does. Does it decrease stomach acid secretions? No, it increases them. This one's important. Does it stimulate bronchodilation? No. It does the opposite. It stimulates vasodilation, but bronchoconstriction. Okay, and that's a good thing because it means, you know, that it will prevent, you know, the pathogens or whatever from getting down into the more fragile parts of the lungs by causing bronchoconstriction of the bronchioles and the bronchi. Does it stimulate nerve endings to cause itchiness and pain? Yes. Does it attract neutrophils? Absolutely. And this one is incorrect because it increases heart rate and force of contraction. Okay. All right. Now, just very briefly, what is going on here? Can you label the structures 1 to 3 and the names of the processes occurring at 4 and 5? Let's start with the processes. What's happening here? Phagocytosis. And what's happening here? We've got all these little debris bits, the pathogens being broken down, and it's being released via some mechanism. So it's taken in by endocytosis and it's being released exocytosis. Yeah. What is number 1? Phagosome. Number 2. A lysosome, yeah. And so this one is a phagolysosome. If in the unlikely chance that giant macrophages ever invade the planet, I'm checking out, right? Because in here is extremely toxic. So it's full of these really powerful proteolytic enzymes, and I don't want to be in there if there's a giant macrophage hanging around. It's very unlikely. Okay, all right. I've got a series of sentences for you. Now, these ones are not going to evolve like the other ones. There's just one statement and you have to tell me what it is. I am a small phagocytic cell that is involved in the early stages of inflammation. I move out of capillaries via blah. I am a what? That's the first bit. I move out of capillaries via diapedicus. I am a... Yeah, but which one? No, which one's really quick? I was just feeling sorry for them. The neutrophil. I am a neutrophil, yeah. Okay, the next one. When we are stimulated by histamine, we contract, which creates gaps just big enough to allow white blood cells to pass through. We are what? 2 words. What are these things called? Lining blood vessel. And they pull apart. Yeah, endothelial cells, and then the stuff can escape through those gaps. Very good. I am a white blood cell with granules in my cytoplasm. I am hated by a lot of people that have allergies. One of the chemicals I release when I degranulate, so degranulate just means when I release all my granules, is I am a what? Histamine is the, yep. So when I degranulate, I release histamine. I am a B. And I'm a blood cell. Basophil, yeah. I have a huge appetite. In fact, my name comes from this. I play a huge role in the inflammatory response, and I interact with lymphocytes from the adaptive immune system. I am a... My name comes from the fact that I'm really large. Macro, yeah, macrophage. Okay, I'm going to give you a couple of minutes to look at this and see if you can fill in most of the blanks. There you go. Everyone's saying about that. You covered one. I won't give you a red green, wouldn't it? I'll give you. You know what? No, it is just in county. Nobody else is coming on. All right, let's do this one together. Humoral immunity is also known as what? Antibody-mediated adaptive immunity, and it involves B lymphocyte. It is responsible for the elimination of something pathogens. Extracellular, fantastic, because antibodies are in the blood. Yes, they have to be extracellular pathogens. Whereas cell-mediated immunity involves T lymphocytes and eliminates intracellular. Okay, now the next sentence is just looking for your understanding of the terminology. Antigenic something on pathogens are recognized by antigenic something on T and B cells. Hello.
Sorry, I just want to check, is your car Subaru outside?
My what?
Is your car Subaru outside?
No, I've got a blue Subaru.
It's a grey car. Yes.
Is it getting booked?
No, we just need that space like in an hour or two, so.
No, mine car.
Okay.
Yeah. Okay, so what are we putting here? Antigenic on pathogens. The antigenic determinants on the pathogens are recognized by the antigenic receptors on the T and B cells. So don't get that backwards. Activation of the adaptive immune response involves glycoproteins attached to the plasma membrane, and these are called what molecules?
MHC.
Yeah, MHC, so major histocompatibility molecules. There are two types. Class 1 is present on all nucleated cells. So if you think about your red blood cells, they're not nucleated when they're mature, they lose their nucleus, but they've got the A and the B antigens, don't they? And the rhesus antigens instead of the MHC. So let's say if you're in the unfortunate situation where you needed a kidney transplant, right? What they would do is they would get the donor kidney and make sure that it matches as closely as possible, because you can never get a complete match unless you're an identical twin giving a kidney to your twin. So they would have to try this as best they can to match the MHC on the tissue, but also you'd be likely to need a blood transfusion if you're having a kidney transplant, so they match your blood as well. Okay, these cells are on the other one. Class 1 is present on all nucleated cells, so class 2 is present on macrophages and dendritic cells. These cells are called antigen presenting, or sometimes called professional antigen presenting cells, and allow for the destruction of something pathogens. So the destruction of, yeah. So remember, they're bringing something in from outside, so extracellular pathogens. So they bring in, say, a bacterium, break it down, grab one of those antigens, attach it to MHC class 2, put it on the plasma membrane, and then that signals a helper T cell, okay, that has the receptor for that particular antigen. And it gets activated, and then the whole adaptive immune response occurs. Okay, presentation of antigen, I just gave you the answer to this. With MHC class 2, activates a helper T cell, or you might call it a CD4 positive T cell, because it expresses the CD4 molecule. Okay. This causes, okay, if I've got an activated helper T cell, what's it going to release? Cytokines, so those chemical signaling molecules that are going to cause lots of other things that act on other T cells and B cells. Once B cells are activated, they something into something cells. Anybody want to answer that? Once a B cell is activated, or they differentiate into plasma cells that make antibodies. On the other hand, the presentation of antigen with MHC class 1 activates cytotoxic T cells, and this results in the destruction of the infected cell due to the action of perforins and granzymes, causing, kind of destruction of the cell, leading to apoptosis. Okay. All right, we're nearly at the end here before we move on to the exam revision. Adaptive immunity. So what you're looking at here is antibody-mediated adaptive immunity. So can you fill in what should go into the pink boxes or something in there that would make sense? So what might we put into this box here? Put in that it's an antigen presenting cell, and even accept macrophage or dendritic cell. But you can see it's phagocytosing a bacterium and breaking it down. What's this green block here indicating? We've got our T cell receptor here, we've got our CD4 binding to this green block. So that's the MHC class 2, yeah, with the antigen attached. So that complex. So we've got a helper T cell here that's going to become an activated helper T cell. And you can see it releases cytokines. Now you don't need to remember them, but one of the really important ones is IL-2 or interleukin-2. And that interleukin-2 would stimulate B cell proliferation. Okay, so what you have to imagine is the receptor for antigen on B cells is just like an antibody or two antibodies stuck into the plasma membrane. Yeah. So this antibody can bind this bacterium, which is obviously the same as this one over here. Okay. So it's bound and this, so it's recognizing this antigen. So this is the one you want to divide because it's going to destroy this bacterium. Yeah. So the cytokines will cause it to proliferate into these plasma cells, but then start releasing all these antibodies. And these antibodies, the same as this antibody that recognize the bacteria to begin with. So it can then neutralize that antigen. But at the same time, what are these things? Clones, yeah, of memory cells. So that then the next time the immune system sees that bacterium, the response is really quick, isn't it? Because you got those memory cells ready to differentiate into those plasma cells again. Okay. Last question, and because I didn't animate it for people yesterday, I'm not animating it today. Oh, no, second last one. Can you just have a look at these little pictures? They're straight from your notes. And besides viral antibodies, yeah, that one is too. What category of antigen inactivation is occurring? I'll give you the first one. All of the sort of viral binding sites and bacterial sites are being neutralized by these antibodies. So that's called neutralization. And the neutralization then will lead to enhanced phagocytosis. And we call that opsonization. Yeah. What would you call this one? And we did this with the blood grouping.
Glutination.
Agglutination. Again, will lead to enhanced phagocytosis. What's this one? This one is kind of the same as this one, but it's happening in a liquid. So precipitation. And then this one obviously is the complement. This will lead to enhanced phagocytosis, and this one's going to lead to destruction, complement destruction or cell lysis. Okay, and complement also drives inflammation. Okay, the last one, which is just not really an activity because it's already done for you, would have been matching those statements to the words on the right. So make sure you know your 4 different types of immunity, the 2 that are passive and the 2 that are active. Remember, with active immunity, it's your own immune system that's doing the work, whether that be by getting the infection itself, or, where's the other one, getting a vaccination. Okay, you're still getting your immune system to generate that immune response. Whereas with the passive, no, your immune system's not doing anything at all. So in a baby, might receive some antibodies in breast milk for protection until the baby's immune system develops. And then in the passive acquired, somebody who has, say, well, it says there antivenom for a snake bite, but it might be, you know, anti-sera, so antibodies if somebody's got botulism or tetanus or something where the bacterial toxin is going to kill them before they've had a chance to have the primary response to make their own antibodies. So you give them antibodies, but this is very short-lived. That's required. Right, just give me a couple of minutes and I'll see if I can find this other slide set. I think it's that one. We're nearly there. I know you're getting tired. Okay. If you haven't had a chance to look on the discussion board, this will all be new, but it's literally just giving you some info about what you'll see when you sit down to do the test, okay? So from your subject outline, well, that's not from your subject outline. The opening date is, but we've extended it until Monday at midnight for you because there are some cohorts that only have their tutorial tomorrow. So it's not really very fair. It's 40%. So make sure to find, like, it's a big chunk of your final grade. So don't do it in a hurry. Find somewhere quiet, settle yourselves down with a cup of tea or something. Go to the loo beforehand. There's nothing like wanting to go to the loo and then thinking you're running out of time. It's 105 minutes, so we have extended the time for you as well. We've given you 15 minutes extra from what it was to begin with. That time will go quite quickly and you will be, I think you'll be busy for the whole time. Yeah. So I'm just putting my microphone on mute, unless, of course, we did have some issues with the quiz, the endocrine quiz, where some people generated 700 words in 40 seconds. So they didn't get a mark for the quiz. It's been obviously not written by them, unless they, if they can do that in that amount of time, I'm going to get them to write my stuff for me. No typos, commas, full stops, everything. So you've all got your mark, so it wasn't you. Okay. MCQs, so there's part A, part B, 45 marks for each, so it's out of 90. I'll just skip through that because there's a better one on this slide. So what we've decided to do is we're giving you 25 questions in the first part of part A. They're just so straightforward 1 mark questions. We've divided it up 5 for blood, 5 for heart, 1 for vessels, 5 for lymphatics, and we have created another category separate on blood pressure because we did it in the heart and we did it in the blood vessels as well. Then in part A, so that's 25 marks, then the other 20 marks are for those various kind of questions, fill in the blank, multi-select statements, what else is in there? Matching statements, and you pull down the drop down, which you liked, didn't you, Cyrus? Did you like those questions?
Oh, no.
The drop
Yeah,
down.
good.
I thought you said you liked them, yeah. So they're in there as well. They're worth 2 marks each, because we did take your feedback on one of the questions where we asked you to do too much for a mark or something. They're the 20 marks. And then for part B, these are not going to be all written response ones. Some of these will be matchy ones as well. But because they might be worth 5 marks, they might be matching more things. Yeah. And there are some written answer ones. So again, you'll get 10 questions worth 45 marks. Now it's up to you where you start. I would suggest you scan everything and then decide. But if you start here, don't get stuck here, because you'll find the time gone. If you start here, give yourself a minute per question. Okay, no more. Just be ruthless. Have a piece of paper beside you on the desk. If you don't know what they are, just write down 9, 10, and 15 and come back and do them. Just keep going. Do all the ones you're really confident with. You know, I don't know that everybody's looking for 100% in the test, but even if you feel like you don't know that much, you'll find that you do when you settle into it. Okay, if you have a study access plan, you haven't sent it to me yet, make sure you do so. We're going to come back to that. Okay. Right, in those various questions for part A, you might be asked to match, order, fill in the blank, label something, or identify things from a diagram, drop down, select, and multi-select questions. I've put this statement in here because what we found for some of the multi-select questions in the quiz was there were 8 statements and we asked you to pick 4. Some people thought, well, if I pick all 8 of them, I'm going to get half marks. But that's not really very good. It just indicates you don't know what you're talking about. So the way the questions are set up, and I think it's fair to tell you, it rewards you for leaving boxes blank as well as for choosing the correct ones. So if you were just to put 8 ticks, you'd actually get 0 because the right minus the wrong balance each other out, you know? So make sure just to put 4 in or 5 in if you're really not sure, and you'll get most of the marks. But 4 is the best. Okay, we're going to do this little question together. Just keep in mind, you won't be drawing arrows. You would be, you know, matching them from side to side. All right, what is the most abundant plasma protein? No, protein, no. Albumin is the most abundant, and it can't, you know, it's responsible for generating that osmotic or oncotic pressure of the plasma. Accounts for less than 1% of blood volume. Yes, Olivia. Buffy coat. So if you spin down a tube of blood, in the middle is the tiny little buffy coat that contains the white cells and the platelets, and it's very small. 55% of blood volume. Plasma, yeah. Plasma waste product. Urea, yeah. Essential for blood clotting. Lucky. Platelets, absolutely. Required for oxygen transport. Yeah, iron. Percentage of a blood volume that is red blood cells. You probably can't see. Remember the hematocrit? Hormone that regulates red blood cell synthesis. EPO. So if you're producing lots of EPO, you're going to have a raised hematocrit. And most abundant leukocyte has to be the neutrophil. Yeah? Okay. Other types of questions that you might see, and in generally speaking, if something is worth 2.5 marks, we want 5 correct statements, and you get half a mark for each correct statement. In your own words, could you explain what determines a person's ABO blood group and also their rhesus group? So what do you think you'd be writing about there? You'd be writing about antigens, wouldn't you? Yeah. That's all that question is asking you about. It's not asking you about the antibodies. It's just asking you your understanding. If you have the A, your blood group A. If you have the AB, your AB. If you only have B, your B. And if you don't have any of them, you're O, right? And then if you have I don't mind if you call it the rhesus factor or the rhesus antigen, or even the D antigen is what it is that gives you your rhesus group. You're going to be rhesus positive, and if you don't have it, you're rhesus negative. If it was kind of like a 5-mark question, it might ask you and identify what plasma antibodies will be present. And then you'd go on about someone with blood group A wouldn't have an anti-A antibody because it would destroy their own red cells, but they'd have the anti-B antibody. Somebody with blood group O would have both the anti-A and anti-B antibodies because there's nothing to attack on the surface of the cell. Yeah, and someone with AB wouldn't have either. All right, can you explain why a person with AB positive blood can't donate blood to a person with O negative blood?
Because the B blood has the antigens that would work against what the O negative blood has, creating
Agglutination. You're almost there. Just be careful. The AB blood has all 3 antigens, right? It's AB positive. It's going in to the recipient who is O negative. And it's the antibodies in the recipient that are going to attack the antigens coming in. Theoretically, it's possible the other way around, but you've got more in the recipient, so the agglutination or transfusion reaction is going to be stronger. Yeah. Okay, let's do this one together. I'm going to select 3 correct statements from the following. Your sinoatrial node is located inferiorly to the AB node and is the pacemaker of the heart. Incorrect. Everyone going for incorrect? Because it's superior to the AV node. Action potentials in the electrical conduction system travel most rapidly in the Purkinje fibers due to the presence of many gap junctions. That is very true. Remember that Purkinje fibers deliver this signal up the walls of the ventricles, so they have larger diameters and lots of gap junctions. Action potentials are slowed at the AV node to allow for sufficient ventricular filling. Correct. Well done. The SA node paces the heart more slowly than the AV bundle. False. So the AV bundle can pace the heart and so can the AV node, but they do it more slowly than the SA node. So because the SA node fires action potentials more rapidly, it paces the whole thing. The right and left bundle branches transmit action potentials through atrial walls. So remember, the AV bundle gives rise to the AV bundle branches. They're right down in the ventricle area. So they're not, that one's false. They're not going to do anything to the atrium. And the SA node generates spontaneous action potentials that pass to atrial muscle cells onto the AV node. True, yeah. Very good. Okay, I'm not going to do that because it's exactly the same as what we did in the immune topic. But just to let you know, the one we did in the immune topic was double the size. We wouldn't give you that in an exam. It'd be more like a shortened version like that one. Okay. This is a 5-mark question, so it's a big one. So you might be needing to give us 10 statements. It's not an all or nothing. You can still get, if you only give us 5 statements, you'd get half marks. Homer Simpson, he's working outside on a hot day. Didn't have much to drink, and after a while, he's a bit dizzy and lightheaded. He also noted that he didn't feel the urge to urinate, and when he did, there was only a small volume that was very dark in color, and he wonders why this is the case. If you were to meet Homer and he asked you for an explanation, what physiological mechanisms would you explain to him to help him understand? So what is causing him to be lightheaded and dehydrated? I'm just giving and dizzy. So he's dehydrated, right? So he's just, because it's a very hot day, he's dehydrated, he's lost a bit of blood volume, and that's going to cause his blood pressure to drop, isn't it? So what do you think has happened for him to produce urine that's very dark in color?
Homeostatic occurs where it's trying to preserve the fluid within the body and not excrete.
That's excellent. But what is doing that?
Is that where you've got your baroreceptor or your activating the chemicals from?
Yeah, you're so close. Anybody want to help? So we got those osmoreceptors that are detecting increased osmolarity of the blood, and the baroreceptors, detecting that drop in blood pressure. So you're going to get antidiuretic. Oh, that's permanent. You're going to get antidiuretic hormone secretion from where? The posterior pituitary. So that's the first thing. What does antidiuretic hormone do? Stimulates thirst. So you're going to drink more water to rectify what's going on. But it also causes water retention from the filtrate. In the kidneys, it moves back into the blood. And if you're moving water back in, you're going to excrete a smaller volume of urine. It's going to be very dark in color because the water is moving back into the blood. But you still need a system to be able to get rid of, waste products. So you excrete low volumes of really highly concentrated urine. Okay, so I think I've got quite a few marks here, right? But you could be even better and then say, well, he's got low blood pressure. That's going to stimulate that other system called the renin angiotensin aldosterone system or mechanism. Yeah. Remember angiotensin. Well, if you go through it all, renin converts angiotensinogen to angiotensin 1, and then ACE in the lungs converts it to angiotensin 2. Angiotensin 2, what does it do? It'll cause vasoconstriction of vessels, increase your blood pressure, but it will also cause aldosterone secretion from the adrenal cortex, which then travels that short distance to the tubules of the kidneys and causes sodium to move back into the blood. Also stimulates this dude to be secreted, and water will follow that sodium back into the blood to increase blood volume and blood pressure. Okay, so I think I got about 20 marks, I think. So anyway, all right, we're going to play a little bit of Jeopardy because and you each have a buzzer. So if you just want to turn on your buzzer while I find the PowerPoint, it doesn't matter who wins or who loses. There's just some questions in here that I think you'll find will help you. If I could find them. Oh, there it is. So you have to hold the button down until you see the light come on. Everybody got it? We'll test the buzzers. Yep, they're both working. Yeah. Oh, actually. I think that's good. Would you like to see what we're Yeah, you two could go together, it's not so. All right, I'll just go this way around. What question would you like? Blood vessels 100. Okie doke. Oh, this might be too hard to play through Zoom. Oh no, it's okay. All of the following are long-term mechanisms of blood pressure, except which one? Doesn't matter if you're wrong. Everyone can buzz, by the way. No, good. Try again.
Okay, B, anyway.
It's not B. Anybody else want to go? Yeah.
D.
D? No, no. You got 50-50 chance. Yeah. A? No, lucky. Oh my God. So they're all long-term. Remember, this baroreceptor reflex is the one that's out, like working right now as I'm kind of moving around, and it will act. You know, if you're lying down and standing up, it will cause your heart rate to increase and cause vasoconstriction. Okay. All right, Olivia, what would you like? Oh, mystery box 100. Hemolytic disease of the newborn is a risk during a subsequent pregnancy in which. Who's that?
I'm gonna say that it's A.
I think that's a very good choice. So the mother has to be rhesus negative, and the first pregnancy with a rhesus positive fetus sensitized her, and then the second one will cause the damage to the baby. Right, Lockie, what would you like?
What?
Blood 100. Okay. Which of the following best describes the function of hemoglobin in red blood cells? Who's that? Yep. Yeah, that's big. For sure. Well done. Oh, you haven't been coming to get your money. But we'll just keep going. Nah, the uni's too poor for that. Okay, Dana, it's just there.
Go mystery box.
Wow. Okay. This is an important question. An increase in extracellular potassium levels can cause what? Yeah,
Is it E?
D? No. I'll explain it in a minute. Anybody else want to have a go? No. That would be calcium, not potassium. Yeah.
See,
It is C. So what you have to think about is if you've got potassium is responsible for repolarization, right? So when those voltage gated potassium channels open, potassium floods out of the cell, right? But if you've got an increase in potassium on the outside of the cell, you lose that gradient. Okay, so there isn't going to be the urge to rush out. So that's going to delay repolarization. And if you delay repolarization, you're going to delay the next depolarization. Does that make sense? So you're decreasing the heart rate. It's a tricky question. Okay, Hafiz, would you like to choose? Heart 100. Factors that will increase heart rate include what? So one of these is just more correct than the others.
what's it, A, but
It's not A. It's not B, even though B is correct, but something's more correct.
But I'll put it C.
Yeah, it is C. So yeah, your blood getting more acidic and increased carbon dioxide will make it more acidic and decreased blood pressure. So that's that baroreceptor reflex will increase your heart rate as well. Okay, Olivia.
what,
Oh, we're getting into the biggies, big bickies. This is an important question too. Which of the following statements is true regarding Starling's law of the heart? Remember him? Frank Starling. Yeah,
Is it D?
it's not D, no. It's something intrinsic to the heart. C, absolutely. So Starling's law of the heart is all about how the stretch on the heart muscle will cause increased force of contraction. So it's intrinsic. It's not reliant on hormones or the nervous system. So if you've got increased venous return to the heart, you're going to get extra stretch and you're going to get greater stroke volume due to the greater force of contraction. Your turn. Oh, you want to get rid of the bingo line. Okay. Which type of immunity in the body is considered to be non-specific? Better be quick. Yeah. C. Yes, very good. Right, we've knocked out the hundreds. Dana.
We'll go back to the immune system for 300.
Immune system for 300. Well, where do T lymphocytes mature? Yeah, the thymus. Yeah. T for thymus. All right, Cyrus. Oh my goodness. Okay. This is not a $500 question. Which of the following has the ability to phagocytose? Although, I will tell you a secret in a minute. Which of those has the ability to phagocytose?
D,
Pardon?
D,
D? No. Which one carries out phagocytosis? I'm going to give you that because we always teach it as the neutrals. So the neutral and the first one in gobblestop up and die off. But basophils also phagocytose. Yeah. So theoretically, we always think of neutrophils and macrophages and dendritic cells, but you were correct. Okay, who chose that one? You did. So Olivia. 300. Oh, which of the following statements is true? I'll give you a bit of time to read that. And that says an A. Who's that? It's you, okay. See, a person with blood group A, AB. Yeah, I think that's a pretty good answer. Very good. It's your turn now. Oh no. Oh no. Immune 4, yeah. Which of the following is not a surface chemical involved in immune defense? Try again, because I think this might be broken. Oh. Try again. I think our buzzers are down. Oh no, who's that? I'm going to give it to Olivia. You might have a dodgy buzzer. C is correct. So that is a chemical mediator, which we didn't really go into too much, but anyway, the other ones are all the surface chemicals. All right, who chose that? Was that you? Yep, Dana.
oh, blood vessels for 400.
Right, yeah, the blood vessels are not being loved. The end diastolic volume can be observed when in the cardiac cycle. Okay, I think your buzzers are.
I think mine's still beeping here, so.
Oh, now try. It's broken.
C.
Not C.
B.
Not B. It's not D. You got it again. I think it's actually this is running out of batteries. It keeps switching off. It's after the atria contract. So remember when the atria contract, they push that last bit of blood into the ventricles, and that's the end diastolic volume. Remember when the atria are contracting, the ventricles are pretty much relaxing. And then they're going to start contracting the ventricles after the atria. All right. Did you choose? Yeah. Happy, it's your turn. 2. Oh, I gave you immune. I'm sorry. Active artificial immunity or deliberate exposure to an antigen is also known as what? Try again. Yeah, I think it's this. Yeah, I think the batteries are gone. Okay, let's just play without it. D, vaccination, yeah. Very good. Now, I'm going to let you go in 5 minutes. So I'm going to give you part 500. What is the significance of the isovolumetric contraction phase in the cardiac cycle? Isovolumetric contraction. Yep. That's a wonderful answer. Yep, so we know it's got to have contraction in it, so it's either B or C. And isovolumetric means there's no volume change because all the 4 valves are closed. Yeah. Okay, I'm going to give you 500 blood vessels. What is the function of the precapillary sphincters in the microcirculation? Yep. D. Very good. So they a little smooth muscle that can contract and relax and either open up or close the capillary beds. You're on fire, Olivia. Okay, I'm going to give you mystery box 500. When blood pressure is greater than the blood colloid osmotic pressure, there is a what? So the colloid osmotic pressure is probably going to be generated by something like albumin, right? Remember I said that was the most abundant protein. When the hydrostatic or the physical pressure, so the blood pressure is greater than the blood colloid osmotic pressure, what would happen? Yeah, it is D. Well done. There is net movement of fluid out of the capillary. And that's what happens at the arterial end of the capillary bed. Okay, the other 500. If a person with type AB blood receives a transfusion of type B blood, what will happen? Yeah, nothing, because AB blood can receive from all the other blood types. All right. Last one. Final round. I can't remember what this one. Oh, yeah, I can. What is the primary role of the vasa vasorum in large blood vessels? What does it do? Yes, well done. So big, large vessels like the aorta and the vena cava will have these smaller vessels that deliver nutrients and oxygen to the vessel wall because they're just too thick, right? So they need help. All right, so we finished. Best of luck tomorrow or whenever you do it. If you've got any issues, just email me and let me know. And we can always do something for you before the test, but not after if you've finished.
One question to follow up on the thought, filling the blanks. Will there be ones that are just straight filling the blanks, or will they always have drop down boxes?
I thought they were all going to be just drop down because I'll let you in the secret. I just don't want this recording. The person who set up